At the Royal College of Nursing, Lisa Elliot. Good to see you on Sky News. Thank you for your time today. What is the current situation facing London hospitals?
Well, we know that London hospitals are extremely busy at the moment. We're still seeing a high number of COVID patients. We've got over 4,000 COVID patients in London at the moment. And we know that sickness absence continues to go up, and that, in line with the levels of nurse vacancy rates that we have and the increasing pressures, mean that currently it's a very challenging situation to work in at the moment.
And what kind of levels of absenteeism have you got currently?
Well, I mean, it's different across the capital, depending on trust, but we are seeing still significant absences due to both COVID sickness and also having to isolate, which is impacting on services across the capital, not just in hospitals, but in the community and in primary care as well.
And is this situation getting worse, or is it stabilised over recent days?
Well, I think the fact that we've had to bring the army in really demonstrates the huge pressures that services are under at the moment. And my members will tell you that it doesn't feel like it's stabilising at the moment. And at the moment, they can't see an end to it. You know, we do have nurses that are exhausted. They really are burnt out at the moment, and they're very, very stretched.
Yeah, what will the army be doing, or the armed forces, certainly the military, be doing now that they have been deployed, these 200 or so?
At the moment, the specific details around what they're going to be doing have yet to be made clear. We know that they are being deployed across the capital. We know that I think it's around 20 are going to Bart's Hospital, but their specific duties, I think, are unclear at the moment. We're being told that 40 of them are medics and will actually be able to help treat patients, and that the others will be in a more supportive capacity.
Can they do the job of absent medical staff?
I think we need to be very clear. It takes a long time to train as a nurse, and we can't just replace that with people doing tasks. And we're already seeing that nurses are stretched already trying to care for patients. Although this is a welcome short-term fix, it doesn't actually resolve any of the long-term issues that we have within the health service.
So a cautious welcome then, it sounds, the military, from you, that the military are being brought in?
We're going to welcome any help that is offered, but it's obviously only a short-term fix. And we have, I mean, let's be clear, in the capital, we've got over 9,000 nurse vacancies. So 200 personnel is welcome support, but it isn't really going to fix those issues that are there.
Could you have predicted such, I presume you're calling it a crisis, could you have seen this coming?
Well, we've known for a long time that there are substantive vacancy rates within London, and that, coupled with the now high vacancy rate due to nurses having to go off sick or having to isolate, I think is the perfect storm, especially as we're seeing nurses having to cope with more and more patients, because we're not only dealing with COVID patients, but that huge backlog of waiting lists as well.
Well, you say more and more patients, but this time last year, the number of people in hospital was less. And even though we know that January's under strain, the health service coped. So why is it so bad this time? Well,
last time we were able to wind down some services, so we weren't doing as many elective theatre cases. But this time we're still dealing with those patients. We're not winding down any services at the moment. We've got many more nurses off sick. We've also still got the vacancy rates. And we've still got 4,000 COVID patients in hospital. So we are still dealing with significant pressures, and we've been working now under those pressures for 2 years. So we also have a workforce that's extremely tired and burnt out.
And how does this translate currently into care for patients then?
Well, it means that nurses are very stretched. As a nurse myself, I can tell you that we go into work and we want to be able to provide the best possible care for our patients. So I can tell you that we've got nurses at the moment that aren't taking their breaks, that are working late, that are coming in on their days off, that are cancelling their leave. But that's not sustainable, and we can't continue running on the goodwill of nurses. We do need to come up with long-term solutions and not just short-term fixes.
Lisa Elliot from the Royal College of Nursing, thank you for your time today.
Thank you.
And thank you for joining us on Sky News today. Coming up in a few minutes, a war of words on the anniversary of the Capitol riots. President